given us an opportunity to come together as a group and have some influence. I've been a patient for close to 40 years, I guess, and I am very proud of the care that I've gotten here 99% of the time, and just so blessed that we have this facility and this staff here to take care of us and our family members. I guess we've been doing this 3 or 4 years. But think about, things really have changed, which that doesn't always happen when you get to be on a committee, as we all know.
This hospital cares. The housekeeper came in, but then she stopped and talked to us. She asked us how we were doing. She asked my mother, talked to my mother even, asked her how she was doing, and she cared enough to, to ask us if we needed anything before she left.
And I agree with my wife on the caring part, recovery from an illness or from surgery, whatever it may be, has an emotional effect on that patient.
My mom is the kind, as soon as she meets, whether it's someone drawing blood or the nurse or the maintenance person, like, what's your name? What's your name? They listened as though she were the only patient they had all day. And I just think that means so much to people. I know it does to me. And people really give you their attention, right? And it really had nothing to do with the cure. It had to do with the kind of care that they received as far as their experience and what they remember.
So we were wandering around, and a guy came out in scrubs, and obviously, I don't know if he was a nurse or what he was going this direction, and we were just kind of like looking around, and I expected him to say, well, go down here and do this and that. And he said, let me take you.
Yes.
So it's just little things like that.
Anybody that is an employee, it's like there's an atmosphere difference when there's that consistent, repetitive high. And it doesn't have to be a long conversation. We're not in our comfort zone at all. And we have no connection to that comfort zone unless they step in some way, form, or fashion.
Yes, think of how you would want your family member, how would you want their nurse or their doctor or their care team to treat your loved one? Can I get you a warm blanket? You're staying with your husband. Would you like a warm blanket? While you're here, maybe we can make it just a little bit better by doing this extra little thing like cutting up his food for him if I exit the room when he can't do it for himself. Things like that. So I just think the compassion is versus, making people their passion and not their project.